Okay, hello, my name is Ryan Hauschi. Today I will be performing a trauma assessment as well as shock management, as well as applying a pressure dressing and a tourniquet to my patient here. So I have my gloves on, as you can clearly see. So first I'm going to look at the scene. The scene looks safe. It appears one patient, it looks like the mechanism of injury is a slash to the right arm. It doesn't look like I'll need any EMS assistance currently, but I will keep that in mind in case I do need it. Doesn't look like any sort of spine injury or anything like that. So I see since my patient has a large laceration on the arm, I'm going to apply a pressure bandage here. So I'm going to hold down and I'm just going to begin to wrap the arm here, trying to get that as tight as possible, just to try to stop as much of the bleeding as I can here.
Perform my secondary assessment.
It looks like that is not enough, so I'm going to go ahead and apply a tourniquet here. So I'm going to put that drip just above the arm, making just above the wound, just so I know, not putting it in that crease here. So I'm just going to go ahead and tighten this.
Check the position of the trachea. Is center.
Go ahead, lock it in place there. And I'm going to check the pulse.
Assess your eyes.
I can't feel any pulse, so that means the tourniquet is good. So now that that's been managed, capillary refill time has been slowed, so you can tell that the tourniquet has been applied properly. So it appears my patient's going into shock because he's still bleeding. He lost a lot of blood. So I'm going to go ahead and I'm going to be in shock management. So I'm going to go ahead and put a blanket on him to make sure that he stays warm. And then I'm going to begin immediate transport since he is in shock and we want to get the best care for him as possible. While he is in, so I put him in, he's in the ambulance, and so while we're going, I'm going to go ahead, quickly take some of his vitals. So I'm going to take his pulse from the other arm. Here, wait, 15 seconds.
Yeah, she's fine. And
Okay, so his pulse is elevated. I'm going to go ahead and quickly take the blood pressure there as well, just to get the base stats.
I would assess the pelvis and push here. She's fine.
Go ahead, apply that.
In the lower extremities, we're gonna go ahead and take a look, palpate both legs. Can you push with the foot? There you go. Palpate the other leg. You push with the foot. Perfect. And then same thing with the arms. Make sure we're fine. You squeeze my hand. And feel pulse. Feel pulse. Just squeeze my hand. Obviously, we know there's an injury there. Pulse, can't feel like there's a tourniquet.
Okay, patient has a lower blood pressure, that's to be expected. So it looks like his airways are clear. There's nothing blocking his airways currently. I'm gonna go ahead and give him some high volume O2 since he is in shock right now. We already went ahead and assessed his breathing and circulation. His skin is pale, cool, and moist, which means, you know, another indicator that he is in shock. In fact, so he's going to be a priority one transport patient, and we're going to take him over to CRMC since he is a priority one, and that is the best trauma place. We already got his blood pressure, pulse, and respiration rate. His respirations are increased. His blood pressure is low, and then his pulse is high. My patient is currently unconscious, so I cannot obtain a sample history from him. We're going to go ahead and perform a comprehensive full trauma assessment since he is unconscious and he can't tell us anything. So first we're going to look into his ears. Those look fine. His nose, his mouth is fine. Gonna feel his scalp. No injuries or anything like that. No blood on my hands. Position of his trachea is normal. There is no distension of his jugular vein. And his spine appears to be all good here. I'm going to go ahead and just inspect his chest, so I'm gonna take his shirt off and look there. There's no chest wounds there. I'm going to go ahead and quickly listen to his chest just to make sure that there's no lap punctures or anything like that. I don't hear anything, normal lung sound, so it does not appear that there's any sort of wounds there. I already felt his chest, it feels completely normal. So I'm gonna move down to his abdomen. I'm gonna go ahead and push on the 4 quadrants of the top, left, right, bottom. All of those feel normal, not firm or anything like that, so that's good. Then I'm gonna assess his pelvis, so I'm just gonna push in. That feels normal, nothing out of the ordinary there. And then overall, he looks fairly good on his abdominal portion, so I'm gonna go ahead and look at his lower extremities. I can't test for motor function since he is unconscious, but it doesn't look like, besides this arm, that there's any other sort of trauma or lacerations there. So I have not found anything else in my secondary assessment, so that does conclude my evaluation of the patient.